Afternoon, everyone. Thank you so much for joining us today. I'm just going to give folks a minute or so to join the webinar and we will get started. All right. Well, I'm sure people will be joining us as we start this webinar, but for the sake of time, I'm going to go ahead and get us started for today. I am Ashley Mangum, and I am the Director of Kids Mental Health, Pierce County. And if this is your first time joining us, first I want to say welcome. But just to give you a little bit of background, we are a community coalition that's aimed at streamlining and coordinating behavioral health services for school-age kids here in Pierce County. And one of the things that we do is facilitate monthly trainings, which is usually in the webinar format, on the goals of helping to streamline information about community resources, and really to provide interventions and different information to the community. I know we talk a lot about what we don't have, but it's always amazing to be able to highlight the resources that we do have. And as we're closing up Mental Health Awareness Month, and the theme for this year is really looking at community and looking inward and looking outward, it was really important for us to highlight some of our resources in the Pierce community, as well as highlight one of the critical resources that we have here in Pierce County, which is our Youth Mobile Crisis Response. So today we're going to give a broad overview of some key components when thinking about the youth behavioral health system. And then we're going to hear from our partners at Catholic Community Services, who can give us some information about their youth mobile crisis services, as well as some additional programs that they have as well. A second goal for today is for us to provide a form of community support where we can also learn from each other. So please, if you can, let us know who's here. Utilize that chat and introduce yourself. You'll also see it at the bottom of your screen. There is a Q&A button. Please submit any questions that you have through that Q&A box, and we will be working throughout the webinar to either answer them through that format or live at the end during questions and answers. Because we have limited time today, we do ask if you have case-specific questions that you submit your questions via email, and we can forward them to our panelists, and we will be able to follow up with you after our webinar. I also do want to note that this webinar is being recorded and will be uploaded to the Kids Mental Health Pierce County website, and we will also share our slides with all of our registrants and upload it to the website so that you can have that information. So with that, I'm going to move us through our webinar today. So as many of you know, we have had a significant increase in the needs that we've been seeing in our community in the terms of behavioral health needs for kids and families here in Pierce County. And I saw this quote the other day, and it was really impactful to me, in just a sense of you just have to pick a headline. And we know that there's not enough in the sense of behavioral health resources for kids that really include that continuum of care. And just to lay in a foundation, I thought it was important to just share some current data around that, in the sense that 1 in 5 children and youth may experience a mental health disorder every year. And it's also important to note that many of our kids are not just functioning in a siloed system, right? So looking at 70% of the youth in the juvenile justice system have a diagnosable behavioral health disorder. And again, it's so important for us to get out of those siloed systems and work collaboratively to really address the complex behavioral health needs of our youth and families, and working together. We also know that resources and interventions are implemented differently, and there's communities that have more challenges of accessing services. So also just wanted to call out that children and youth of color, LGBTQI+ children living in rural communities, and children that have intellectual or developmental disability are at increased risks. and calling out too that a lot of it is due to systemic racism, sexism, homophobia, and other types of oppression and marginalization. So again, as we're going through some of these kind of broader level resources and strategies, I really think it's important to call out that we know that there are disparities within our system. We know that there's an increased need, and a lot of times these communities are not able to access that. And that's something that we'll talk a little bit more into as we continue into this presentation today. And then the big thing is access. As we know, that has continued to be a challenge. When we had the pandemic, a lot of services had to pivot or either change. They were no longer able to be in person. A couple of our inpatient unit facilities have closed, and that has a tremendous impact on access. And as community partners and as people who are working with youth and families, or if you're a parent or your youth looking for services yourself, I think it is important for us as a community to have a broad level of what is accessible in our community so that we can help navigate parents in the right direction. We can help youth navigate in the right direction. Some of the hardest things that we used to do when I used to work in the emergency department is give a parent a piece of paper and say, here's all these numbers, call them and they'll be able to help you, only to find out that their services have changed, the numbers have changed. And it was just an opportunity again to have a parent feel like there was no support and guidance in that. And so it's really important to call out that even though we know that this is a need, 1 in 3 children who are enrolled in Medicaid are actually not able to access the services that they need. And it's even fewer for kids who have substance use disorders. The other thing that I thought it was important to call out is we know that there has been a huge increase in utilization of emergency departments, utilization for behavioral health challenges. And it's important to note that even after an emergency department visit, 35% of those kids and youth did not follow up with timely care after discharge. And so all of these things really is kind of the key driver of what we're trying to do through Kids Mental Health Pierce County to really develop a streamlined and coordinated behavioral health system here in Pierce County, where we can make sure that there really is no wrong door to accessing these services, right? We want to make sure that if a kid comes through any of our agencies or organizations, that we're able to point them in the right direction and have that warm handoff so that youth and families are able to get the access of services that they need. This, for me, really reflects the importance of the need for collaboration and cross-system partnership in really addressing youth mental health needs. So as you can see in this visual, a lot of times when we're working with youth, a lot of times we're interfacing with them just as an individual. But if you look at this diagram, it really shows out all of the different spheres of impact that we're working with when we're working with youth and families and how they can impact and shape their mental health. So that includes the family, the community, the environment, the society. So many of those things really contribute to that individual presentation. And that is why, again, it's going to be so important for us to collaborate, work together, and really put community into that care continuum. So again, we can really work towards making sure that kids have the right service at the right time and hopefully as close to home as possible. So as we were developing this training, we were thinking about some important things to consider when you're looking at navigating the youth behavioral health system here in Pierce County. And so we wanted to highlight some of those strategies just to put into your toolkit. And if you have additional things that you think that we should be adding to this, please add it to your chat. The first thing that we would just really want to call out is youth and family voice. It is so important to include them in any recommendations that you're going to make in terms of recommending any service or resource for a family. And some of the key components of that are, is the youth voluntary for services? A lot of services require that they consent. And so even though we may feel like that's something that they may benefit from, it's really important to know whether that's something that they want and whether they're going to be voluntarily willing to participate. It's also important to hear from the family. It's important to refer families to culturally and linguistically appropriate services and to have a better understanding of their family dynamics and their family voice, again, into our recommendations. That could really help with engagement and getting them connected to the right service. So again, it's really important to have that youth and family voice involved when you are considering making referrals or giving them resources to help navigate the behavioral health system. Age is another important thing to consider. So definitely wanting to take into consideration that age 13 is the age of consent here in Washington State. And so making sure that we are involving parents for those youth that are under the age of 13 and really understanding their age and their developmental needs as well is going to be really important when making those referrals or engaging them in resources. Insurance type is also something that you definitely want to consider. We talk about this all the time, but unfortunately, insurance does have a direct impact on access. And we know that Medicaid eligible youth are able to access services that maybe commercial covered youth are not. And so again, it's really important to have some knowledge about some of their insurance information to really help them navigate, because again, we don't want to recommend or refer them to a program that they're just going to be not eligible for due to payment. And I do have a helpful resource that I will share with you towards the end of my presentation that can help you with that insurance information. Another important component to think about is their school district. A lot of school districts have partnerships with community mental health providers or contracted providers to provide either in-school or virtual supports. And so I highly encourage you to reach out to your school counselor, or if there's a mental health liaison that you can reach out to get an awareness of what resources are available within the school district. And then also, if you do know what type of mental health treatment you're looking for, thinking about what type of mental health provider do you need. So it's really important to know, there is a continuum of care when we talk about behavioral health. And I have a visual later that I'll show you that, we're really thinking about prevention through recovery and reintegration. And so thinking through of if you're making recommendations about, is it counseling, is it medication management, do you need a specialty service? Those things are really helpful, again, when navigating the mental health system to be able to accurately identify a provider for what you need. And if you don't know what you need, that's okay too, but that's specifically for if you do know what type of mental health provider that you are looking for. And then lastly, just considering accessibility. Again, we get MDT requests so many times, and we hear about services that just are not available in certain communities. Our families that have limited resources to be able to travel or transport kids to certain appointments, or this time of day isn't going to work. So all of those things are really helpful. I think one of the most powerful quotes that I heard from a parent through this process of just learning more about, engagement and collaboration is that we don't need another door to an empty room. And I really think about that every time we make a recommendation for a family, is we don't want to, again, give them a resource that's just going to lead them to no, because that's not what they need to hear, particularly when they're in a crisis or having a really high need for resources and support. And so again, these are things to consider to ensure that we are really pointing families and youth in the right direction to be able to get them access to the services that they need. Just to build on that previous slide, I did want to just share some information as well about access for minors. It is very much different from the adult system. So there are 3 different ways that youth are able to access mental health treatment here in Washington State. So the first option is adolescent initiated treatment. And what that essentially says is for any youth that's 13 to 17 years old, they can consent to their own mental health treatment. For minors under the age of 13, they would need that parental or guardian consent. The second option is what we call family initiated treatment. And so what that means is if a child or youth has been assessed, or an adolescent really over the age of 13 has been assessed, and they have met medical necessity to say that they meet criteria for either inpatient or outpatient treatment, and the youth does not want to consent to that treatment, a parent or guardian may be able to initiate what we call family initiated treatment, or FIT, which allows the provider to work with the youth under a certain amount of sessions or in the inpatient setting for a certain amount of days to try to engage that youth into that treatment. It still is considered voluntary treatment, but it is another layer so kids can access treatment and providers can better engage them in that process. And then the last option is what we call involuntary treatment. And essentially what that says, if you are 13 and older and there is a presentation of imminent danger to themselves or others, or what we call grave disability, meaning that your presentation means that you cannot meet your basic care needs. You cannot make any decisions that warrant a safety concern. We are able to then refer them to what we call a designated crisis responder, or a DCR, and they're able to evaluate the youth, and they can court order them into mental health treatment if they meet that criteria. And so those are 3 different ways that youth can access treatment. And I think, again, it's an important thing to know when you are helping to support kids and families. And the other thing that I would try to say is, on the clinical side, we always strive to pursue the most least restrictive option. So before getting into that involuntary treatment option, we're going to try to do the adolescent initiated, we're going to try to do family initiated treatment. And it's not until those have been exhausted and have been documented that those are not going to work that we would pursue that involuntary treatment option for adolescents. We definitely want them engaged in their treatment plan, and that definitely shows better outcomes for kids when they are in treatment. The other thing I wanted to share, because I know this question comes up often, is about information sharing. And there has been updates to the RCW about that, in the terms that mental health providers are allowed to communicate some adolescent treatment information to parents. And this is if the provider believes that sharing this information would benefit the treatment process. So in those situations, providers would always want to talk with their adolescent about what they want and do not want to share, and have conversations with them before they would disclose any information. But as you can see on the slide, these are some of the things that providers can share when it is deemed appropriate and would benefit the treatment process. So that could include their diagnosis, their treatment plans, their medications, their safety plans. Again, we know that it's so important for your natural supports to be a part of those plans in treatment. And so a lot of times providers would do their best to engage the youth and their natural supports in those plans. I do just want to call out that it is different for a substance use disorder. In those situations, a written release is required to share information about a substance use disorder. And as I mentioned before, again, I want everyone on this webinar today to understand that there is a care continuum when we talk about behavioral health. And, we look at what services that we have available here in Pierce County, and also some of those gaps, which really allows us to be able to advocate for those different things. But it's really important for us to build and have and sustain a really robust care continuum. And for me, I want to see this look like, in a few years, community, right? Who are our youth partners? Who are our grassroots organizations that are in those youth spaces, that are working with our young people to really build up that prevention side? But I think it is important for our community to know that there is a care continuum, and it really is about finding that right type of service for youth and families at the time that they need it. And one of the resources that I really just wanted to highlight with that, because as I was going through the registration questions, I saw that there was a lot of questions about complex co-occurring discharges and other circumstances, and what resources we have here in our community. And so I just wanted to take time to just highlight the Kids Mental Health Pierce County Community Multidisciplinary Team Meeting. It has been a wonderful resource in our community. Anybody in Pierce County can make a referral. And what that does is it goes to our program coordinator, Vanessa Adams, who I believe is on this webinar today. She will review it. She reaches out to the referent, and we are able to either provide behavioral health navigation and support, or if it's appropriate, we can convene a community team that could be of various systems partners. So as you can see on our screen, these are some of the examples of the participants that we have in these MDTs. And it's really been an amazing forum to bring cross-systems collaboration, where we're able to streamline resources, have these conversations all in one place for families to be able to, again, streamline resources and help support some of those really complex behavioral health needs. As somebody who's facilitated this, it's not uncommon for us to have 20 or 30 volunteers on the call. And oftentimes we hear, even if we can't agree on what the resource is or what the plan is going to be, we so often hear from parents that I've never had this many people show up for my kid. And that just speaks to the essence and the community here in Pierce County. And I'm so grateful to be a part of a community that does show up for our kids in that way and continues to be that resource for families who often feel like they've exhausted every possible option. There is a QR code that is on the slide that will take you directly to the MDT resource on the Kids Mental Health Pierce County site, so you can learn more about that resource, how to make a referral, and some frequently asked questions. And that is a perfect link to our website. So I really wanted to take the opportunity also to highlight the Kids Mental Health Pierce County website. Part of our mission with Kids Mental Health Pierce County is to serve as Pierce County's hub for comprehensive pediatric behavioral health information. And so this is our site. We work hard to keep it as up to date as possible to make sure that all of the resources are in real time. If you are a organization that is providing services, we're happy to share your information through the website or our newsletter. There are so many resources. If you have not been able to go onto our website, I highly encourage you to do that. There's also a QR code that will take you right to it. But we have resources from crisis to specialty services, services for youth with intellectual and developmental disabilities, parent support, some inpatient, outpatient mental health providers, substance use disorders. We have a special resource for Black, Indigenous, and people of color, our BIPOC. We have a find a provider tab that literally will take you to a link to be able to look for a provider. You can also refer for MDT. And as I mentioned earlier, there's an insurance tab that will give you information about commercial insurances that provide behavioral health navigation, if they have a managed care organization who they can reach out to, and have some additional strategies about behavioral health navigation and support. And so I highly encourage you to look at that resource. It's been amazing to see the utilization of it in our community. We've seen it in school counselors' signature lines. We've seen it in doctors' discharge plans. And so it's a great resource that if you had to think of something on the fly to say a parent needs mental health resources, where can I send them? I would highly recommend sending them to kidsmentalhealthpiercecounty.org, where we can either support them, they can submit a request through the website, or they can be linked to any of our community resources that are already listed on that website. So this is our contact information. Again, I just want to thank all of you for being a part of this discussion. And, you know, we talk a lot, again, about what we don't have, but it's so important to highlight what we do have. And we're always trying to figure out ways to streamline this information into the community. Every time I do a training, I always like to ask, how many people know that we have youth mobile crisis services? And oftentimes we don't get a lot of hands raised. And so that is such an important thing to know about because of the impacts that it has on youth and families when they are directed to other systems that can have a significant impact. You know, I think about how we as a community have taken the stance to say, you know, when it comes to child abuse and neglect, we're going to have a protocol to make sure that we are not re-traumatizing kids and that we're not duplicating interviews. And I really feel like we need something similar for kids in mental health, because how our current system exists, you know, it's hard to imagine that your first time telling somebody that you're not well, that you are transported into a hospital, or you're transported by law enforcement to the hospital, where you have to tell your story to the triage nurse, you have to tell your story to the doctor, you have to tell your story to a social worker, and then you might be referred to crisis services. And we're currently doing a data survey, not a survey, but we're currently doing chart reviews where we're learning more about how kids are being sent to Mary Bridge and the impacts of families. And what we're learning from that is a lot of the triggering events and the conflicts are actually happening in the home or in the community. And so to be able to have a resource like Youth Mobile Crisis Services that are able to meet kids and families where they are is going to be super important. And so I think we all have a role within that to be able to know about this resource and share it to families in real time, so that we can really be able to serve kids where they are and for what they need. And so with that, I'm actually going to transition over to my good friend Rhoda with Catholic Community Services, that's able to give us a presentation on our Youth Mobile Crisis Services. So I will turn it over to you.
Thank you so much, Ashley, and thank you everyone for coming. This is a crisis really is what in my heart. It serves a great service to the kids and the community. I'm from Catholic Community Service, Family Behavior Health. I do work with crisis. I'm the clinical manager over the crisis team. However, we also serve FAST and WISE. So I'm just waiting for Ashley, do you have my slides? Or I can maybe pull them up.
Yes. Are you able to see them?
I do not see them. I just
Okay.
see your last
Okay,
contact.
let me stop share and get back on.
Okay. And so we serve all of Pierce County with the crisis team primarily, and I'll talk a little bit more about the WISE and the FAST, but just touch bases on that. But yes, we do serve all of Pierce County. We also serve children who land possibly they're going crisis in the surrounding area, King County, Thurston, or Kitsap County. If they're in one of those counties and they go into crisis, then we'll respond to there. Also, if any of those youth go into crisis in Pierce County, we'll also respond to where they're at and serve them as well. So we do get, you can change the slide, Ashley. We do get the referrals from community, from the hospitals, from homes, wherever that may be. And we do work all 24/7, every day of the week, Christmas, holidays, at 2 o'clock in the morning or 2 p.m. in the afternoon, we respond to the home. So we do work with the whole family. That's a big thing, as Ashley was saying, in dealing with crisis, we do need to safety plan with a responsible guardian. And so we do work with the whole family or whoever they see as their supports. Primary purpose really is safety in the home for that moment and stabilization. We're always strength-based, we're solution-focused. We collaborate with other organizations, other primary care providers, the hospitals, a lot of times the police and the EMTs. And we also utilize youth and parent peer supports, families that have or youth and or parents that might have gone through similar situations, and we partner with the family with them, and they may have some insight maybe to give that the clinicians may not have. Okay. So when to call, really when there's a crisis that occurs. If you need any safety planning, a brief mental health assessment, any questions for a complex youth having mental health issues, or any high risk and or dangerous behaviors, especially issues of self-harm. We get calls for, we can respond to suicidal ideations, any self-harming behaviors, aggressive behaviors. It might be that someone's extremely depressed and hasn't left their room for a couple of days. We'll respond to that. Or someone's having an anxiety attack. We often respond to families and homes where there's a lot of arguing. The parents at their wits' end. Will respond to those types of calls, or running away behaviors, any type of risky or dangerous behaviors we can respond to. And if police need to be called, then that's something we can also do. But a lot of times it doesn't rise to that level. We can also assist, as Ashley was saying, if the family or youth feels like they need inpatient hospitalization. A lot of times what we see when we respond to that, it's really the family kind of needs a break a lot of times, and maybe a little bit of respite, and we can help problem solve with that too. We also respond primarily if there's a need for immediate intervention. If you think that they need to go to the hospital or possible jail, or out of home placement, or if there is at risk of serious harm, as I stated before. And then oftentimes when a family does reach out to the crisis line, whether it's the family or the youth, there's really kind of feeling of hopelessness. And what we can do with a solution-based and strength-based is really come into the family and help them find some solutions. And really in a crisis moment, we're there not to solve the problem that they have on a long-term basis, but sometimes it's really just what can we do tonight to keep you and your family safe, and tomorrow we can reassess. We respond, you can change that slide, Ashley. Thank you. I'll go back, but we respond to a home, wherever the youth is. We'll respond to a home, the hospital, a primary care provider. We will go wherever the youth is. We've responded to grocery stores. We've responded to tents. We've responded to street corners, wherever it is that youth is having a crisis. We do ask for pertinent information. What the age is, who the caregivers are, but really we can respond with just minimal information. Always safety first is what we think of, and we try to develop family-centered safety plans with that. We also recognize that, as stated earlier, that families often feel hopeless and they're tired. It might be that a family stayed up with their youth because they've been having suicidal ideations for a few days. So they're up 3 nights in a row and they just don't know what to do. We can provide in-home support, family support, while that family rests. We can provide lock boxes. We can provide some pretty creative strategies so to minimize that risk. Again, we're always, we review the strengths and the needs in all of these areas. We do a pretty thorough risk assessment and pretty thorough safety plans. So the population that we serve again is 18 and under. If a youth is living as a child, and there might be, and when I say living in a child, maybe they're still in high school at 19 years old, or 20, we'll respond to that as well. It doesn't happen very often. Youth are referred via the Pierce County Crisis Line. It goes to Crisis Connections, and they do a triage, and then they will call us and send us out. Except for police and the EMT, because we, their time is very valuable, as is everyone's, but they can call us directly and skip the crisis line, and we'll respond to wherever they're at. So they get a little, they'll just call us directly. We provide a face-to-face evaluation. We do have a 2-hour contract, or 2-hour time response per our contract. However, our data shows that we get there within the hour. So there's very minimal wait. And also, if need be, we can, while we're en route, we can be on the phone with them and trying to de-escalate and triage while we're even out to that response. Our clinical, we do have a lot of clinical, our clinical team does, we have 8 people on our clinical team, and oftentimes, like I said, they do collaborate with that family to do a pretty family center safety plan. It's a written safety plan. All the family members that are involved review that and sign it. We also refer for additional informations. We always have what those next steps are. Usually it's calling the PCP, any primary care provider, any therapist that they might have ongoing. We'll connect with them. We'll connect them to psychiatric services as needed. And again, provide any other strategies that they may need. While they're open with us in crisis, which crisis stabilization can be anywhere from 1 day to about 7 days. The average is around 3 to 4 days that we stay open. And each day that we are open with the family, we do make contact with the family. So each day someone's either reaching out by phone and or going out there in person and reassessing the family's needs. And then we make sure that they have a solid plan, and then we'll refer to other services if needed. Okay. All right, and this is just kind of a review on warning signs. It's always nice to review these, just kind of red flags. Again, it always doesn't look like depression, doesn't have to be sad. They might be irritable, withdrawn, or sometimes maybe even have more energy. Any changes in that behavior, loss of interest, maybe they're isolating, and I'm keeping an eye on what is different. Maybe they're eating, maybe they're not taking care of themselves, loss of friends, maybe they're feeling less connected, maybe talking about things that they really didn't talk about before, and then just paying attention to the environment. These are some things, and when we go out there and do a risk assessment, these are some of the questions that we'll ask them. Was there any recent deaths? Anyone that you know who died by suicide? You know, what's going on in their activity? Did they just quit the soccer team? You know, what's kind of going on? And then also, I do see that the media and you know, all the devices that the kids are on, and I'm not privy to all of that, but you know, TikTok and all those other media devices sometimes does romanticize suicide. So we try and keep up on those. Sometimes substance use, if it's increasing, that can impact a decision. And then just being paid attention to what is, you know, what is said. Oftentimes youth might not say, I'm suicidal. Maybe it's, I wish I wasn't here anymore. I'm no good to anyone, those types of signs, something to look for. Okay. I'll go over FAST just really quickly. FAST is our family stabilization team. We can work with that up to 21 years of age. The Medicaid FAST is up to 90 days. And exciting news is that we also serve FAST for private insurance families, and that's up to 8 weeks. And then we do get referrals from hospitals, community members, schools, and families can refer. And this is where the child or family are impacted by family conflict, emotional behaviors, safety, or protection issues. This is usually where there's maybe one or two life domains that are affected. Maybe someone significant passed away in their family. Maybe they moved in the area and they're having issues. And so we can do a shorter intervention, intensive shorter intervention. We also provide crisis stabilization while they're open, and also do a safety plan and a treatment plan as well. So these services, again, are solution focused, and they also have youth peers and parent partners available to them. And again, it's designed for rapid stabilization. The WISE services, as most of you are probably familiar with, intensive services, we serve youth up to 21 years old. Again, the referrals come from the same area. The team also has youth peers, parent partners. This is an intensive, and this is for families that maybe have several areas of that are needed work on with several life domains. So it might be that there's historical trauma. It might be that you might have a parent struggling with substance abuse. Maybe there is some sexual abuse of the child, just multiple life domains that we can work on with the family. These interventions run anywhere from the average from 6 months to a year, but we do have families that we've worked for on 18 months or even up to 3 years. We also have a smaller contract with that we started actually this year with the Tacoma Public Schools, that we go into some elementary and middle schools and work with youth that were identified by the counselors. They go in there and do assessments, some minor individual counseling, and then refer on to other services. So that's exciting. For police and fire, please, Ashley spoke about this as well. If you don't have to take the kids into the emergency room or call the police, please call the crisis team. Police and fire are very busy. The emergency rooms are primarily meant for medical emergencies. Again, we can be there within the hour. The police can call us directly, and we'll be on the phone with them, and we'll try and triage and get there as soon as possible. And then again, we'll go out immediately. We've even gone and safety plan, help the police safety plan, and so they were able to leave, and then we went and followed up. So we deal with parent conflict, parent-child fighting, sibling relationships. Again, just to reiterate, suicidal ideations, any cutting behaviors. So running away as well. We will respond to that as well. This is just a graph that's really just showing the different years. Oddly enough, during COVID, our crisis response went down. But then again, you can see how it ebbs and flows. The summer months are usually less busy, as we get a lot of our referrals from schools. But I do feel that people are happy when the sun is shining. So, and that's consistent. I think CPS gets less calls during the summertime as well. And I think this is it shows the difference between the or compares the hospital call, the calls that we get from the hospital and the community. Our goal is really to have the community calls larger than the hospital calls. We really want to get out there and defer from youth going to the hospital, families and youth going to the hospital. What we have heard from families is that they're sitting in the ER room for quite some time. And again, as Ashley said, then they're talking to the doctor, and then they're talking to maybe a nurse, and then they're talking to the social worker, telling their story over again, and then they talk to us. So we might see them, I don't know, 5 to 8 hours later, and they're just exhausted by then, when we could have been in their home within 60 minutes. And they could have been in bed by that time, and they would have a safety plan and some type of ongoing plan that we could help them carry out. This is just a short review of some of the impacts that we've seen and still ongoing from the pandemic. One, there's an increased workforce shortage for us, but also we see that it's impacting parents and stress in families. Access to services, remote services were a little bit different. There's a backlog of families waiting for outpatient services, especially in the private insurance arena. Higher acuity. We're seeing more serious attempts and more serious self-harms. And we're seeing youth that really didn't have any prior mental health history and crisis. And those were attached to the community a lot. And now that was taken away from them. And so that was very difficult for a lot of the teens that we saw. And now they're just now getting more connected. And then we're seeing a lot more firearms in the home. I'm not really sure why that is, but that's always a huge safety precaution. And we have various ways in helping families get those locked up or put into another place while they're dealing with a crisis situation. We have added our peer response to Mary Bridge, where we co-locate, but also the peers now go out on every crisis that occurs from 7 a.m. to 7 p.m. There's either a youth partner or a parent partner that goes out as well. We see that the caregivers are a lot stressed, and there has been an increased volume over the past few years. So we see that there's more need in every area, and that the providers are struggling to meet the demands, which can be very frustrating to the families. I hear that over and over again, that they feel that there's a lack of support, that the waiting lists are very long. So those are some of the impacts that we've seen in the pandemic. And I think the point, you can go on to the next slide, Ashley. What I really want to reiterate is, please, if there's, we respond within hours, a lot of times sooner. We can be creative. We'll go wherever the crisis is at. We'll work with the family and other supports. So if there's not a need for law enforcement, if no one's physically hurt, please give the crisis team a call. We will respond there. We'll help work things out. We'll stay there for as long as you need us to stay there. We'll spend the night with your family if needed, or, the families, whatever it is. We can be creative. We had a youth that his suicide plan was to jump off a bridge. He lived right next door, a couple of blocks down from a bridge. And so we actually helped put them up in a hotel by the ocean, where there was no bridges in the area, just so we could help stabilize that crisis and get them into a better spot. So there's a lot of creative things we can do. Like I spoke really quickly, but wanted to get that covered. Again, you can call, my number is on here. Feel free to call me at any time. I had a parent the other night call me at 11 o'clock at night because he saw my name on a brochure. I answered the phone, and we were able to provide him with some assistance. So.
Well, that is absolutely amazing and so important, Rhoda. I really just want to shout out the work of Catholic Community Services. Your organization and response has just been amazing. We've had some really, really complex situations, and one thing I can always count on is that you guys are going to be at the table and part of the solution. And so I just really, really appreciate that. As I mentioned earlier, we are doing this study, and if you're not on our implementation team, we're going to be going through this actually tomorrow at our implementation team. We looked at 200 patient charts, and one thing that we learned is almost 100% of the kids that came to the emergency department were directed there by some type of community partner, whether it was a school, whether it was a primary care doctor, whether it was law enforcement. They directed them there. And what that tells me is that having this education and learning more about these resources, that we're able to divert some of the unnecessary trauma that goes with having such a invasive response as going to an emergency department if there isn't a medical need to go, is going to be so critical as we continue to adapt and become innovative and really support kids and families where they are. So I just really appreciate you, Rhoda, and sharing this information. I also just want to encourage any of our community partners that are on this call. We have come to law enforcement agencies and done this training. We've come to school districts to do this training. And I'll say one of the school districts that we work closely with have reported their decrease in ED utilization now that they know about these resources. And it's been really helpful in building those relationships. So if this is something that you think would be helpful, for you to be able to bring to your organizations or your systems, please reach out to Rhoda and and we're happy to coordinate that. Rhoda, I did see that there was a question that came up in the chat, and I don't know if you can highlight this, but what are the current wait times for FAST for private insurance youth, and do you serve Kitsap County?
We unfortunately don't serve Kitsap County. The waitlist currently is about 2 weeks.
Thank you. And I will say for Kitsap County, we are also partnering with the Youth Regional Navigator Program. And so Kitsap is part of the Salish region, and they have implemented that program. And so they are going to be standing up a multidisciplinary team in a regional hub. And so if you need connections to Kitsap County, please reach out to myself or Gina Cabadoo with the Kids Mental Health Pierce County program, and we can get you connected to some resources in Kitsap County. Are there any other questions? Thank you. Thank you so much. That's really the goal of this. Again, the more that we can streamline information and get it out to the community, there are so many wonderful webinars on the Kids Mental Health Pierce County website. If you have an idea or you recognize a need for training, please reach out to us. We're always looking for new content. We're looking for new opportunities and new ways to partner. And so again, this is why we're doing this work. We know that a lot of times there's pockets of our communities that don't know about these resources, and we really, really want to be able to highlight them and know that they exist and be able to address any questions that people have about them so that they can be utilized.
Can I add as well, if any of you would like us to come out and give a presentation or answer questions or provide any other information, we're always happy to do that. We can go out in person or virtually, whatever suits you. And again, I am sincere when I say, please, if you have any questions about anything, or hey, would this be a proper crisis call or whatever, please reach out to me. I do mostly answer my phone, but if not, I will get back. So
yes, thank you. All right, well, if there are no other questions, that means Rhoda, you did a phenomenal job of providing an overview of your program. I'm going to let me just double check. I'm going to go ahead and end the webinar for today. I just want to thank all of our participants. I want to thank Rhoda for providing such an amazing overview of these critical and so important resources for our kids and families. Again, if you have any questions, don't hesitate to reach out to us, and please visit our website, www.kidsmentalhealthpiercecounty.org. Have a great rest of your afternoon.
thank you.
Thank you.